So welcome everyone, and thank you for joining us at our Because They're Kids session. This is an educational webinar, and as I said, it will be recorded. The recording will be posted on our website. I will also be emailing it out maybe later tonight, but probably not until tomorrow morning. That way, if you miss anything and wanted to rewatch or share with family and friends, you'll be more than welcome to do that. So my name is Helen, and I'm helping to facilitate this evening's session. I also have Emily Green in the background helping me keep an eye on the Q&A. So we will do our best to get to all of the questions. If we don't, we will follow up afterwards and put together a little question and answer sheet. We did that in the past, and I believe it worked well. So tonight we're discussing the COVID-19 vaccine for children. With so much information out there, it's been really hard to navigate how to keep not only ourselves, but also our kids safe during this pandemic. There are so many decisions to be made. So we're here at Lehigh Valley Reilly Children's Hospital to help provide you with as much information as you need in order to feel like you're making the right decisions. So to get started, I just want to go over some general WebEx housekeeping. All participants have been muted with your video cameras off upon entry into this event. It's just a way to eliminate feedback and distractions throughout this program, and it also helps us maintain privacy and HIPAA compliance. So all of your comments and questions will be anonymous and hidden from other participants. With that said, we absolutely want you to participate, and we encourage you to do so through the Q&A panel at the bottom of your screen. And if we run out of time, again, we will do our best to answer all of your questions, but we will follow up with participants using the email addresses you registered with. So I'm going to pass over the presenter rights to our two lovely physicians who will be presenting about the vaccine today. So Dr. Brown and Colabroy, whenever you are ready.
Great. Good evening, everyone. I am Dr. Kimberly Brown. Welcome and thank you for joining us. My colleague, Dr. Colabroy, and I will be presenting information regarding the prevalence and consequences of COVID illness in children, updated vaccine recommendations pertaining to children, and results of the vaccine trials in children 5 to 11 years of age. Next slide. Some of the points that will be discussed in greater detail this evening include the Delta variant virus is more infectious and has caused a large surge in pediatric infections with COVID. And while it does not cause more severe illness rates, the overall number of severely affected children has risen substantially simply because so many more infections have occurred. Because of this, hospitalizations and deaths have risen also. Over 750 children have died of COVID in the United States, according to recent data. Long-term COVID complications, or so-called long-haul COVID, absolutely occurs in children also. And given these concerns, controlling COVID in children is an important strategy for controlling the COVID pandemic overall. The next two slides demonstrate the surge in pediatric cases this summer and fall that I discussed earlier. So this is data from early in June showing that at that time, more than 4 million cases of COVID-19 infection had occurred in children. That was happening at a rate of about 14,000 new cases per week. Overall, the hospitalization rate was ranging from state to state reporting somewhere between 1% and 3% of cases of infection. And fortunately, mortality rates remaining low at 0.23% of all COVID deaths. As we fast forward to the end of October, we see that in just that few month time period, the cumulative number of cases has now risen to over 6 million cases of COVID-19 infection, with 200,000 new cases per week occurring in the month of September. That resulted in greater than 15,000 hospitalizations, again, with a hospitalization rate of somewhere between 2 and 4% of cases of infection. And again, an overall low mortality rate, with the percentage of all deaths being about the same, approximately 0.03% of all childhood cases of COVID resulting, unfortunately, in death. Next slide. Specific to children in the 5 to 11 year age range, there have been more than 1.9 million cases of infection, totaling about 9% of total US cases. That's resulted in more than 8,300 hospitalizations, approximately 100 deaths. And so for this age group, COVID is in the top 10 causes of death. This is a graphic illustration of that sharp rise in pediatric COVID infections in August, September, and October, and that's the steep rise on the right-hand side there, with some decline in the surge more recently, but as you'll note, still with greater than 100,000 cases per week being reported in late October. And then the next two graphs depict more local data. So this is testing data from LVHN in this time period. And again, you see this sharp rise in symptomatic cases resulting in testing, particularly in September, and still persisting at a fairly high level. And then in the next slide, these are the cases that tested positive. Again, we see this very large number in September. And although there has been some decline since then, a persistence of a high number of positive cases in our area, and we are certainly seeing that in our practices, in our private offices and in our clinics, many children who continue to be infected with the virus. In particular, you can see that the red line is reflecting this for children in the 6 to 12 age range. And the number of infections you see is still in the range of about 100 new infections, even as it's declined somewhat. So we are still seeing a very frequent number of infections in all age groups, but particularly the school age group.
We wanted to discuss a little bit about the implications of COVID in these pediatric patients and in your children, and what we're seeing in our offices and in our hospitals. So as Dr. Brown had mentioned, the pediatric hospitalizations due to COVID are continuing to climb, and we are getting a cumulative effect that's happening there. It's interesting to note that about a third of these hospitalizations do require ICU level care, and so some of these kids can get quite sick, need respiratory support and other ICU level services. Many of you have heard of the sort of after effects of COVID and this particular multi-system inflammatory syndrome in children, or we call it MIS-C. And this is something that can pop up for sometimes 6 weeks after a child has been infected with COVID. And it does not always have to be a significant or a serious case. It can be an asymptomatic or even a mild case, and that they can have this constellation of symptoms, including fever, rash, GI symptoms, mouth or eye problems, and the treatment typically requires hospitalization for the treatment of shock and IV therapy treatments. And it's important to recognize that the age group that has just come up for the vaccine, the 5 to 11-year-olds, are the age group that are most infected with this multi-system inflammatory syndrome in children. And we have also seen in practice and across the the nation, really these post-COVID conditions. So myocarditis is something that's going to come up as we talk about the vaccine, but it's important to note we're seeing this at similar to other post-viral rates of myocarditis in kids after COVID, and then some prolonged lung inflammation in patients, especially those of our patients that have asthma. So definitely some direct effects of COVID-19 in this, in our children. Lots of indirect effects, and you guys, I'm sure, have been experiencing this, as I know I have, having young children in my home, that, we're dealing with a lot as the result of COVID in our community. And clearly there have been growing number of mental health issues, depression and anxiety in the kids and the teens, and this is just something that we're struggling to help meet the needs for. There have been a lot of implications in the school system, so widening educational gaps because of school closures. We are also noticing health issues as it pertains to obesity and kids having lack of access to food, healthy food that they would get in school, to the lack of physical activities because of limited ability to do some of their extracurricular activities. And not insignificant, this loss of the parents and the caregivers, and there's been a lot of deaths because of COVID, and that has impacted children in so many ways. And then, as we sit here on technology, there's many of our patients and many of the children in our community that are spending a lot of time on technology, and that also has been affecting them. This is a really interesting slide here that just shows the COVID-19 related K through 12 school closures just from August to October. And look at that red number there, the estimated number of students affected. So over 1 million students in just, this 3-month time frame since schools open that were affected by school closures because of COVID. So we want to bring all that information up so we can talk about why it's important to think about vaccinating. And, we talk about protecting your kids from these direct and indirect implications of COVID, and that vaccines are really the best way to help protect them. So vaccinating can help to decrease the number of pediatric cases of COVID-19, which is, really something that we feel passionate about. And hopefully by doing that, we can decrease hospitalizations and ultimately death in children. Thankfully, death in children is really rare. It's just rare across the board. But the fact that COVID has become one of the leading causes of death in kids means that, we need to be doing something about this. And we certainly want to be preventing any complications from COVID, like this multi-system inflammatory syndrome and the post-COVID symptoms that we mentioned prior. So there's been some modeling that's been done. What happens if we vaccinate kids, and does it really impact what's going on with the pandemic? And some of this modeling has shown that if we actually are able to vaccinate 5 to 11-year-olds, we can expect to see an 8% decrease in cases from the November to March timeframe in these next coming months. That's over 600,000 cases that can be prevented by being able to protect this age group. And certainly the fewer cases we have out there, the less our risk of developing and spreading a new type of variant like we saw with the Delta variant. So Kim's going to talk a little bit more about the vaccine.
Right. Thank you, Jill. So the vaccine trials in 5 to 11-year-old children were conducted utilizing the Pfizer vaccine. Approximately 5,000 children in this age group were enrolled in the trial, with data on more than 3,000 children who were given the vaccine presented to the FDA. And the results demonstrated that children developed a strong antibody response to the virus in response to the vaccine. Efficacy was greater than 90% against symptomatic illness. And thankfully, the vaccine did not lead to any unexpected or intolerable side effects. And no children in this age group in the trial developed myocarditis, or this inflammation of the heart following vaccination. So based on that, an emergency use authorization was granted by the FDA at the end of October and endorsed by the CDC on November 2nd for 5 to 11-year-old children. The dose is 10 micrograms, which is 1/3 the dose that is received in older children and adults. It's given in a slightly smaller volume and with a smaller needle. Similarly, there is a second dose that is required in 21 days. And again, as with the vaccine in older children, there is a 15-minute observation period that's recommended after each dose. And the summary of the safety data is here. The common side effects are what we've heard about before with the vaccine. So there can be some discomfort at the injection site, fever or chills, some fatigue, headache, and sort of muscle and joint pain. Again, consistent with what we've seen in the older age group. But interestingly, in the younger children, there is a lower rate of reported side effects. This we are used to. We see this as well with other vaccines, that younger children tend to have fewer side effects while still having a robust immune response. So if you look at the reported rates of side effects here compared to those reported in adolescents, we see that anywhere from 1/4 to 1/2 the number of children in this age group reporting the common side effects. And again, there weren't any unexpected side effects, and no children in the trial had myocarditis following vaccination. We know that at baseline, this myocarditis, as Dr. Colabroy mentioned earlier, which is an inflammation of the heart, can occur after viral infections, after a variety of them. It certainly occurs after COVID illness as well. In general, those cases are less common in younger children, and that, in combination with the fact that the vaccine is at a decreased dose in them, is likely why we, at this point, have not seen that side effect in these young children.
So let's again highlight just some of the benefits of getting vaccinated. So we can certainly be a big part of stopping the spread. And so many kids that I've seen come in here are just so excited to do their part. It not only protects the child that's getting the vaccine, but helps to protect those around them, maybe younger siblings that are yet unable to be able to do that. It can keep our schools open, which is just such an important part of keeping a vital child growing and learning. And if the schools are open, it can keep your kid in school. They're not having to be quarantined because they are exposed from somebody in the school. And then obviously we can help protect those at risk for complications. We have a family member who is a high risk kid, and that's always been our goal, is to protect him, and making sure we're all doing our part. So some things to know if you sign up for one of our vaccine clinics, what can you expect and what do you need to know in order to do that? So the official recommendation is that the vaccination is now recommended for everyone 5 years and older. You have to have turned 5 in order to get it. I've had a couple of 5-year-olds show up here on their birthday, so that's pretty exciting. The COVID-19 vaccine can be given at any time, before, after, or at the same time as routine vaccines and the influenza vaccine. So when the vaccine first came out for adults, they were asking for a 2-week waiting time period. That is not the case for adults even anymore, and it's certainly not the case for kids. So if you came for your routine well visit and got some shots, they can go the next day and get their COVID vaccine. If you've just gotten your flu vaccine, which we highly recommend, then you can still come and get your COVID vaccine. The easiest way to schedule an appointment to be able to do this is through the MyLVHN app or online application. And we have 5 vaccination sites through LVHN, and we also are doing vaccination clinics at 2 of our practices at Trexlertown, and then the practice that I'm at, our Richland Township practice. So far in our clinics, we have over 10,000 kids in this age group that are scheduled, and we've given over 4,000 doses, and they are dosing as we're speaking at our Trexlertown office today. And the amazing thing is, I've talked to a number of families, is we really had very few side effects that have been reported. No kids that had any issues in their wait periods, you know, a few sore arms, and that's really been the extent of the symptoms. We are all about making it fun in pediatrics, and our goal in these COVID clinics is to help the kids feel comfortable and be excited about what's happening, because this is really a great thing. So we get it that it's scary to get a shot, and sorry, my screen flipped there, and we're trying our best to make that as easy a process for them as possible. We've had some mascots show up, and we've had some giveaways happening, and so I think everyone has had a really positive experience. This picture was from our first COVID clinic here at Richland Township. I think just something to remember if you're bringing your kids is that there is that 15-minute wait period, and so it's helpful to come prepared, you know, with something to do during that time frame. So this ends our formal presentation. We wanted to just present some information for you, and we wanted to be able to leave time to talk about what would be helpful as far as the Q&A. So I'm going to stop sharing my screen right now. Helen.
Yes, thank you so much. A lot of great information. I'm seeing a lot of great questions come in. So what I'm going to do is I'm going to start from the top and work my way down. And if we don't get to any, we will follow up with you. And if we don't know any answers, or if any of our answers change between now and, you know, next week or whenever, we will also update that as well, because we know everything is rapidly changing these days. So our first question is, why should parents of healthy children who are concerned about the long-term effects of the vaccine, namely links to the heart problems and RNA depositing in ovaries, vaccinate their children?
So I can address that if you would like. As we mentioned, even if your children are healthy without underlying illnesses or risk factors, they still remain at risk for significant consequences from a COVID-19 illness. So if you look at the number of children who have been hospitalized due to severe illness with COVID, or to long-term consequences of the COVID illness, such as MIS-C that we discussed earlier, some of those children did not even have noticeable infection with COVID, and yet have suffered these severe consequences that result in hospitalization. And if you look at the number of patients who've had to be hospitalized, over a third of them have had no identifiable risk factors. They've been perfectly healthy children until they became ill with COVID-19. So while it is true that most healthy children have mild illness with the virus, that's not always true. Mm-hmm. And in addition, they can then spread that virus to other members of your family. We see very commonly that the virus runs through the entire family. So anyone who's been, babysitting, which include, of course, parents, siblings, but that's, grandparents and other family members who are actively in contact with the child as babysitters or caregivers, often become infected as well. There are a very small number of older patients who have developed, it's actually not considered a long-term complication, but they have developed a side effect of the vaccine, which is called this myocarditis, which is an inflammation of the heart. And I think the most important thing to understand is, first of all, it's rare as a side effect. So it's about 1 in 10,000 or less who receive the vaccine, and that's in this older age group. We're quite sure it will be substantially less than that in the younger age group of children. So it's very uncommon, and if it happens as a result of the vaccine, what we see is that it is mild, in almost all cases, transient and not requiring any treatment. And even in the few cases that do require treatment, the treatment is very effective and there's complete recovery. Contrast that to infection with the COVID-19 virus itself, and there is a much higher rate of myocarditis resulting from the illness itself. And so that's the main thing to really get, is that we're always looking at, what's the benefit and risk of a vaccine, but what are we preventing? What are we working against? And what we're working against is a much higher risk of myocarditis from the infection itself, and it's more severe. And that can be from the infection when it occurs. It can also be from this MIS-C that you're hearing about, where there can be really severe heart involvement requiring intensive treatments in the hospital, and there have been deaths that have resulted from this. So that is really the major consideration for why you would favor vaccinating over taking the experiencing or exposing your child to the risk of being infected. There is no long-term effect of the vaccine. So the vaccine itself is just a set of instructions. So you get the vaccine, it provides, there's a short-term production of a protein, which is found on the virus. And then your immune system learns to respond to that protein. So it's a set of instructions that your immune system receives. That protein disappears, the message disappears over time. There is no such thing as incorporation of any DNA or RNA into your own DNA or RNA. There is no effect on the ovaries or future fertility or pregnancy. That is misinformation that's out there, unfortunately, and it's become very popular misinformation and widely spread, but it is not correct. So that does not occur, and there is no risk of long-term complication in that regard. So that's the good news.
Great.
Thank you for the question.
All right, our next question is asking if the vaccine is safe for kids with food allergies, and they particularly mentioned peanuts and tree nuts.
Yeah, this is a question we get a lot. I've had my own patients messaging me to ask about, if it's okay with their child's allergies to go ahead and get the COVID-19 vaccine. And the answer is yes, it's okay. There are no food allergy restrictions, and there is an issue with some of the polyglycols that exist there, and they will ask those questions, but that is actually something we really rarely see in kids being a form of an allergy. So yeah, it's pretty unusual that you would be disqualified from getting the vaccine because of an allergy history.
And just in case you're wondering, when they asked you about that polyglycol, if any of your children have ever taken the over-the-counter or as prescription, the stool softener called Miralax, which is super commonly used, that's what's in there. So if your child has taken Miralax for any reason and not had any problems, you can say with confidence there's no issue.
Yep.
Yeah, that's really good to know. I didn't know that.
Yeah.
Yep.
All right, so our next two questions are related to Dr. Brown's first answer about long-term effects and worrying about vaccinating a child when children are not really getting as sick as adults. So she touched on that question, and we'll include it in some of our information afterwards. So then the next question is asking, can medications still be taken the day before, day of, and day after? So my daughter takes one baby daily. If fever arrives after vaccination, can fever reducer be taken, and should it?
So I can take that one. So it is not recommended to pre-medicate before the vaccine. So we don't want to give something that would suppress the immune response. And I think it's helpful to keep in mind that the side effects that you experience from the vaccine are a manifestation of your immune response. So we actually want to develop an immune response. And so if your child after the vaccination is experiencing fever or discomfort, you can certainly try Tylenol as a first choice. That is a good choice for if there's any systemic, feelings of fever or discomfort. If it's just local discomfort at the vaccination site, often a little cool compress will help with that. We would say that ibuprofen, so that could be Motrin or Advil, is okay if there's significant side effects afterwards, but we would recommend Tylenol first, which is what we give with our regular vaccines to children, if they're experiencing any side effects.
Great. Okay, I have two questions that are related. One is asking, why is the dose smaller for ages 5 to 11? And then the second half of the question, I'll scroll back down, is should we be taking into account a child's size in addition to age? So they're asking because their daughter just turned 5, but she's small for her age. So should they wait a little longer for her to get to grow a little more to get vaccinated?
Those are great questions. And yeah, certainly stuff that we talk about a lot. So first of all, I think the important thing to remember with actually any vaccination is it goes based off of how old you are and not how big you are. So we have babies in the NICU that will still get their 2-month vaccines that are really small, compared to other babies that might be 2 months old. And a lot of it has to do with your immune response. And that's really the key for the COVID vaccine as well. So the cool thing about kids, and this is what I love about being a pediatrician, is they have really awesome immune systems, and they are really good at figuring out what to do with vaccines. They've had them, over the years, maybe a little more frequently than we adults have. And so what happened, as they look through the trial, and they anticipated this, as they were looking at appropriate doses, is that the kids had a robust immune response to a fraction of the dose, and they were able to get equally as protected as adults were with a smaller dose. And that's always our goal, and that's been our goal over the years with other vaccines. As they've looked at this, they've tried to decrease antigen levels in the vaccines to really try and minimize side effects and maximize the immune response. So that is why the dose is smaller, and it really doesn't depend on size, it depends on age. And so if your child is 5 but the size of a 3-year-old, it is still okay for them. They've been around for 5 years, they're okay to get their COVID vaccine. One of the other questions that tends to come up in relation to this, and I'll just mention it, is what happens if they're going to turn 12 soon, because the dose changes, between that 11-year and that 12-year birthday. And our official sort of position is, it's really important for them to get vaccinated as soon as possible. And so go ahead, if they're 11, today, and they can get vaccinated today, but they turn 12, in a few weeks, and then they will get the 12-year vaccine after they turn 12, and they'll get the 11-year vaccine as an 11-year-old, and that's fine to do. So that's where they landed on that. But there isn't a recommendation to wait until they turn 12 to get that higher dose.
Yeah, and I think that's a super common question that we get also. And we advise, don't wait. If you have a 5 or 6 year old child, now's the time to vaccinate. It's a smaller dose, they're less likely to experience side effects, and yet they're going to get all the immune benefits of the vaccine.
Yeah.
Okay, so I'm going to put a few together about some of the research that was done. So there are a few people asking about the sample size that was used. How does that compare to the adult sample size? It seems a little small. And based on the research, how do we know it is entirely safe to vaccinate this age group? So if you want to touch on that a little more, that would be appreciated.
So the research that was done is building on the research that was previously done. So we do have ongoing trials in different age groups, but the number that was used for this trial is sufficient for looking for response to the vaccine. Because that's really what they're looking for. And this is what Dr. Colabroy was talking about as well, that you're looking for the dose that is effective and that we show that it provides protection from a symptomatic illness. And of course, we're monitoring for side effects, which again, fortunately, in this age group have been fewer and less significant. And keep in mind that that data collection with regard to safety of the vaccine is ongoing. It's ongoing for all age groups. So they continue to collect the data, and anything that's new or different will, of course, be newsworthy, and we'll all be notified of that. And, that's what this process is. As pediatricians, we are entirely used to new vaccines being put into place in order to protect against illness. And so in the course of our careers, many new vaccines have come along. And when you first start using them, you know the effectiveness, you know the safety data that you have at the time that you're starting to use the vaccine. And the process is the same, that you monitor for side effects in an ongoing fashion. So that's what this is as well. And as we present more data over time, we're going to be monitoring for any additional side effects. But so far, in all of the children that are being vaccinated currently, we are seeing that it's well tolerated. And again, we are not seeing any unexpected nor any intolerable side effects in this age group. So it's all good news.
Yeah, when I actually spent some time listening to the American Academy of Pediatrics talk about this very topic, and they made the point that this was it's bridging studies, and so they're like Dr. Brown had mentioned, they're building off of all of the data that we have before and trying to add to that information. And some of the numbers they gave, over 1.4 billion people have gotten this vaccine across the globe, and it is the single most highly studied vaccine that we have, which is pretty impressive. And really, in the history of vaccines, if we're going to see some, concerning side effects, it's going to happen in that first few month time frame after the vaccine is gone into the population. And so we've played out that time frame with our with the study group as well as with the adult population. So I think that helps us all feel more comfortable with being able to recommend this vaccine.
Yeah. The other thing to be aware of is, I think sometimes people are under the impression that this was a rush job, that this was new technology and a rush to get it out there. This type of vaccine has been in development for over 10 years. And this technology that's used for this, making a little protein that the immune system then is, instructed on how to respond to in the future, has been developed previously for different vaccines, just not one that's well known. So this is not brand new stuff. This was fortunately we knew how to do this. Our scientists knew how to do this so that when we needed to develop it for a different virus, that's why they were able to do this in the fashion that they did, and why we've been able to, enroll so many study participants, when we were first, studying the vaccine in order to start using it. And now, as you said, we have such high numbers in the various age groups in which it's being used. And we really are seeing that over time, it is very, very safe, and that it has the potential and already is preventing so much in the way of severe illness, hospitalizations, and death. So we want to provide that benefit for children of all ages.
Okay. So I'm going to lump some additional mRNA questions together. So one is asking, have mRNA vaccines ever been used on children before? If so, how widely? And then we have, sorry, bear with me while I scroll. I'm trying to do this efficiently now. Well, I guess you can start with that one and then I'll find the others. So have they been used before in children?
So none of our current vaccines that we use regularly for kids are mRNA vaccines. The mRNA technology is a little bit tricky for the everyday application in the office, because, as many of you have heard, it needs to be stored at very cold temperatures that require a special amount of freezing, and then it is not super stable when it comes to room temperature for long periods of time. So it is just not a great vaccine to have in a pediatrician office where you have to vaccinate kids all day long. And so, you're always looking at all of these different factors. And this is when people come to our office and ask us, can we get the COVID vaccine? You say, well, unfortunately, we can only defrost so much of it at so much time and use so much of it at this point in time. And so there's just some logistical components that go into this, and, have not played out in the technology part of it. So it is not part of our current vaccine scheduling.
Great. And then with that, they were wondering, how can we be sure there are no long-term side effects since it's new? And then do we know if a vaccine that is not the mRNA type will be coming out for kids? I know some adults prefer to not get that version. So they're wondering if that will eventually be in the pipeline for kids.
So there are vaccine trials that are ongoing. We don't have any current sort of timeline for distribution of a non-mRNA vaccine for children. I don't know of a timeline for that. While there's certainly work that's ongoing, I don't know of anything that I could say is coming at any particular time. We can certainly update that information.
Yeah, I'm sure that's rapidly evolving.
Yes.
All right. So I also see a bunch of questions about asking, how long should I wait after my child has a cold, or if the child has already had COVID-19, should they still get vaccinated? So what is your advice about considering vaccines with recent illness, or even if they just received another vaccine?
Yeah, so as we mentioned, there's no wait time after any other vaccines. So they can get that COVID vaccine at any time that it's available for them to get it. That is fine. As far as illness goes, I think it depends on how sick the child is. We all know we're entering into what we like to call our sniffly nose season. Everybody has a little bit of something all of the time, it seems like, especially when kids are in school. And so if they're having some baseline congestion infection, that's happening, that's not really anything we would tell you to wait until it cleared, because you could be waiting for a very long time. So if they just have minor symptoms, as long as there hasn't been any recent fever, or they haven't been, seriously ill, then it should be fine for them to go ahead and be vaccinated. So just really some interesting data that came out of what do you do with kids that have had COVID before, and do you get them vaccinated, and when? So there is no wait time after COVID infection in order to receive the COVID vaccine. We just request that you be off of quarantine so that you don't get anybody else sick in getting that. And part of the studies that they looked at when they did these trials in kids was what happened, as far as side effects and antibody response to kids that had, antibodies already because they had prior COVID illness. And I was a little concerned about this myself and how I would recommend it to people. And actually, those kids did really well. They seemed to have less side effects than the kids that did not have prior COVID illness. And so that was very reassuring to me. As you could imagine, they had a really nice, robust immune response without the negative implications of the side effect. And so it kind of acts like a booster to their antibody system, and it helps them, have more prolonged protection against hopefully future strains of COVID that are coming. Well, hopefully not.
Yeah, I think that's right. And that's good advice, that it's important to still get vaccinated, because the data is showing, particularly in children, that it is vaccination, it is that two-part vaccination that really gives the prolonged immunity, whereas the other immune response can fade. And for practical purposes, because of the isolation period with infection, we recommend that you can get the vaccine 2 weeks from, the time that you're diagnosed with a COVID illness.
And related to that, we have someone asking that kids can be asymptomatic with COVID. Could it hurt your child if you unknowingly vaccinate them while they have COVID?
Another good question. And we do not have any evidence that that is a risk factor. So that question comes up also for flu, and the answer is the same. So it is absolutely okay to vaccinate. And that's why we say, if, if your child has, as we say, a little bit of the sniffles, it's okay. If there's fever or significant illness or wheezing in a child who has asthma, or, significant vomiting or diarrhea, anything that you would say, oh, they're really sick right now. We don't want to vaccinate then, because first of all, they're already sick and they don't feel well. But secondly, you might not get the immune response if they're really sick. You might not get the same response from the vaccination. But some sort of mild illness, no problem.
Great. Okay, so we have, I know we're over time, but these are really important questions. So if you have a few extra minutes, I want to ask one more question and then sort of do a closing. And I promise we will follow up with people of questions that we didn't get to. I'm so sorry if we missed it. There was a lot coming through, so we had to jump around. So they were asking about the boosters. Do they need boosters? And if so, there are some information out there about when you should get your boosters. So that there's information saying maybe 6 to 8 weeks is better for the second dose versus the 3. So talk to us about the booster shots.
So right now, the only people that are recommended to get boosters are in the over the 18 age group. And, right, the official recommendation really has to do with your job and your risk of exposure with your job, or your own sort of immune health if you are immunocompromised. And so we are not widely recommending booster doses for children. That has not come out yet as a recommendation. So, I mean, obviously, we're talking about the 5 to 11-year-old age group. We're not even there yet. And then for the kids that were in the 12 to 15 year old age group that just were able to get vaccinated in the May timeframe, you're kind of just coming up to the point where they would possibly consider 6 months out, if they got their second dose, whether or not a booster would be beneficial. And we just don't have the data as far as I know on that. I don't know if you've heard anything different. I see Dr. Villalobos is also hanging out in the wings there, but we don't have any further information on that.
And I would just like to take this opportunity that I do see we have Dr. Villalobos with us. And if there's any additional comments or a modification that you'd like to add to any of our answers that we gave to any of the questions this evening, we certainly invite you to add your wisdom. We'll regard silence as a good sign. You've done well.
Thank you, ladies, for such a good presentation. Thank you for the participants for being in and being concerned about something that is new and is bringing a lot of questions about a lot of level. And, all in the pediatric department have been working tirelessly to try to provide you with the most accurate information that we have at the time. So in Leo's time, I didn't want to interfere or kind of provide you with information about the hospital patient, which I do take care of the most the sicker patients that have COVID or MIC, but you can submit your question. I'll be happy to answer those through the email part. And I think all the questions were answered regarding the long-term effects. I know there is concern about that because the vaccine is new, but with all the safety and the number that we have and the technique, we don't foresee those side effects happening. There was somebody asking about the myocarditis or pericardial inflammation, and we did see actually 3 adolescents that did have that after the second dose. It lasted for 24 hours. They were all observed. They were all seen by our cardiologists. It was after the second dose. So far, they have no further sequela. They all continue to be followed. Compared to our kids with MIC, with all the literature says that up to 35% of those children will have cardiac involvement, and we don't know how long and how affected the heart will be, but because they do have impaired function and they do have cardiac failure. Some of these kids that have passed away from the MIC is because of the consequence of the heart and lung damage that can be permanent on those children. So even though it's very rare, this is one to always aim to. What we consider is risk and benefits. The risk that may be attributed to the vaccine and really, really little significant compared to the risk of having the actual disease and the consequences. And that's what this is all about, trying to keep your kids healthy and try to minimize the side effects related to the natural disease. And I can give you more information on Ebola. Actually, the other mRNA vaccine that has been trialed is the Ebola vaccine. It's an mRNA. The studies are being done and done in Africa. They include children 12 and above, and actually FDA approved for 18 and older. So yes, they have been another mRNA vaccine that have been trialed in older children. Okay, but that's
Thank
the
you
information
so much.
for the public. Yeah.
Thank you so much for adding to the discussion. That is our infectious disease specialist at Lehigh Valley Reilly Children's Hospital, adding her expertise to the discussion, and we really appreciate that. And again, the main message is that the complications of COVID-19 illness itself can be very severe. And can result in long-term consequences, the full extent of which we don't even know yet because we haven't followed them, for that long. And and death, as we said. And what we see from the vaccine is very little in the way of side effects. And even when there has been this side effect of some inflammation in the heart, it is brief, it is mild, it resolves on its own, or to therapy with complete resolution. So that's that risk benefit looking at things that Dr. Villalobos is discussing.
Yes, of course,
Now
I'm
she
on
got it.
mute.
got
There's
it.
always one silly thing I do during this. Last time it was my dog going nuts. Anyway, we will continue to work on answering some of your questions virtually, but we want to give you back your evening. This session is recorded and we will email it out maybe tonight, but probably not until tomorrow. So feel free to keep your questions coming through while I record them. But thank you so much to our panelists. This was amazing. Be sure to look through the comments. There's a lot of thank yous coming through. And have a great evening, everyone. We will follow up with you shortly.